Welcome to Wednesday's edition of COVID-19. There's been a further jump in new infections today, adding weight to prospects of a fourth wave if people fail to abide by safety precautions. Meanwhile, on Korea's inoculation drive, it appears to be on track as over half of all those in the first priority group have received their first dose of the COVID-19 vaccine. Here's Kwon So-ah now with the broader pandemic coverage. So let's start here, as always, in Korea.
Yes, Sunny, we have another uptick in cases this Wednesday with 470 new infections confirmed as of 12 a.m. And also the number of domestic transmissions has now risen to the mid-400s with the number of imported cases similar to Tuesday. And with that, Korea now has a total of 93,733 infections and 3 new fatalities just like yesterday. And if we take a look at our graph now, we see that we have now more days with infections in the 400s, so that has outnumbered the days in the 300s. And currently, with that, the average number of daily domestic transmissions in the past week has also surpassed 400, and that actually meets the criteria for level 2.5 social distancing measures. Now, currently, the metropolitan region is, however, under level 2 social distancing measures, with Gyeonggi-do province today seeing over 200 infections, followed by 138 in Seoul, and also Incheon, Chungcheongbuk-do province, Gangwon-do province, and Ulsan have infections in the 20s, while Jeju-do Island here with 2 new infections has hit 600 total cases now. And with cases still scattered across the country, the government has vowed to expand testing to prevent any resurgences, and that's also been reiterated by Prime Minister Chung Se-kyun at an earlier briefing.
One of our most important tasks is to find in advance any blind spots that can trigger a fourth wave of the outbreak. We have to make full use of our expanded COVID-19 testing capacity, which is now capable of screening 500,000 people a day.
And what's also approaching 500,000 is the number of people who have received their first dose of either AstraZeneca or Pfizer vaccines, with a little over 60,000 vaccinations on Tuesday.
Right, so I hear concerns over variants are growing across the globe.
Right, Sunny, variants are leading to not only concerns over rebounding cases, but also the effectiveness of vaccines against these variants. Now, in Germany, reportedly confirmed its first case of the B.1.525 variant, known to be much more contagious than the widely known UK variant, which is now confirmed in 19 countries. And also, variants have spread to almost all states in the U.S., which is also dealing with a homegrown variant. And officials in the U.S. are saying that the next 2 months will be crucial in deciding whether the U.S. will see a resurgence of infections. It is slowly approaching 30 million infections. And here, the UK and Germany now are seeing slight declines in daily infections, somewhere around between 5,000 and 7,000 daily cases. But here, France and Italy are seeing around 20,000 daily infections, with Italy recently having hit 100,000 fatalities related to COVID-19. And the total number of infections around the globe stands at 118.1 million, and we're seeing quite a jump in daily infections here, which was at around the 300,000 yesterday, and also almost 10,000 new fatalities. And those are the updates I have for now. We do not have afternoon briefings on Wednesdays, so I'll be back with more tomorrow. Back to you, Sunny.
All right, so thank you for that. Right, as So-ah mentioned, highlighting the importance of preemptive testing, authorities here have announced plans to set up temporary screening centers outside of the Greater Seoul area as well. I have Kim Han-il here in the studio with details on that. Welcome, Han-il.
Good afternoon.
Right, so let's begin with this latest initiative aimed at putting a lid on the spread of the virus.
Sure. So there are currently 98 temporary screening centers in Seoul and its surrounding areas where people can get tested for free. Yesterday, the government announced that the plan to expand these testing centers outside the Seoul metropolitan region to 6 other regions as well. Top health official Lee Sang-won said yesterday that in the past 3 months, these temporary testing sites have successfully identified close to 13% of all COVID-19 cases during that time span. The authorities concluded that early detection from these test centers have proven to be effective in curbing the spread of the virus. This is why the government decided to set up additional testing sites in 6 regions outside the capital, including the cities of Busan, Ulsan, and Daegu. These temporary testing sites will be set up in areas with high foot traffic, and anyone can get tested for free, whether or not they have suspected symptoms. This move comes with the government warning of a possible 4th wave of the pandemic amid the reopening of schools and the warming weather. Pointing to recent cluster infections involving younger citizens, KDCA warned the public to avoid visiting crowded places and to limit their stay to a short period of time. Take a listen.
다시 한번 말씀드리지만
I'd like to emphasize once again that those who do not follow prevention guidelines such as mask wearing at public use facilities are raising the likelihood of the virus spreading. Please avoid unnecessary gatherings and follow all safety rules at crowded venues such as bars.
Right. Meanwhile, Hanla, here there's been some comforting news regarding visits to nursing homes.
Right. Starting from yesterday, in-person visits have resumed at long-term care facilities such as nursing hospitals and nursing homes. However, they will only be limited to patients who are in critical condition or in their deathbeds. All visitors applying for face-to-face visits must have tested negative for COVID-19 within 24 hours prior to their visit and wear full protective gear, including a clinical face mask, long-sleeve gowns, protective goggles, gloves, and foot coverings. However, virtual visitations at nursing hospitals are currently allowed under Level 2 social distancing, and at long-term care facilities under Level 2.5 social distancing. Visitors will not be allowed to eat or drink on the premises and will be checked for any symptoms on the day of their visit.
Right, and on the vaccination front, the government has decided that doctors should decide on the fate of vaccination for those in critical condition.
Right, as we know, patients and staff at nursing homes are the first in line to receive their vaccinations. But when it comes to patients who are either unconscious or who refuse to receive life-sustaining treatment, the government thinks it's up to the doctors to decide, and they should follow doctors' guidelines. Top health official Hong Jung-it said during a press briefing yesterday that life support and COVID-19 vaccinations are 2 separate matters, adding that the decision should be left to the medical staff after consultation with the patient's family members. Meanwhile, the government will decide by tomorrow whether to administer AstraZeneca vaccines to people aged 65 and above. Earlier last week, the government put AstraZeneca vaccines on hold for this age group due to questions on efficacy. But new studies from the UK suggest that the vaccines are effective on the elderly. The KDCA plans to convene an expert committee meeting today to reach a final decision. And if the AstraZeneca vaccines get the green light from the government, it would open the door to elderly patients at long-term care facilities receiving their long-awaited vaccines.
All right, Hannah, as always, thank you for that. See you again next week.
See you then.
Right, on the international front, Germany has decided to extend its shutdown until the 28th of March, but is allowing some non-essential businesses in areas with low infection rates to reopen. Now, the move comes amid efforts to balance government concerns over the impact of variants and public hopes for some sense of normality. For more, I have Jan Rubel over in Berlin live on the line. Welcome back, Jan.
Hello, Sunny.
Right, Jan, let's start with the overall COVID-19 situation there and the presence of variants in Germany.
Yes, we are now in the middle of the 3rd wave, which is characterized by new mutations coming in from South Africa, Great Britain, and Brazil. By example, the British variant now has a share of more or less 50% of all the new infections we have in Germany. And now we have also this new variant from the variant, the so-called B1525. But this is only now since 2 days, and one case. It's said to be more contagious, but until now it's difficult to say. Overall, the situation is very difficult to predict because, I mean, we have a bit more new infections, but significantly less deaths. So, I mean, it's very difficult to forecast. The numbers are stagnating, whereas they fell sharply in January and February. This means the current trend with a little bit more infections now is probably due to the mutations we have now.
I see. Jan, as I mentioned earlier, the lockdown has been extended, but authorities have also agreed to a phased reopening plan, I hear. Could you tell us more about this?
Yes, you know, the people here are tired. They were demanding for a perspective, and this put a pressure on the politics. They had to decide to do something in order to go into the direction of easing. So they are prolonging the lockdown, but there are a lot of regional exceptions. For example, school classes. Some school classes can go back to face-to-face classes, and you can go to museums and to shops if you make appointments. And under the condition that in your district, I mean, the number of new infections stays under a certain level, which is generally, I mean, I think it's 100 cases of new infections per 100,000 inhabitants in the period of 7 days. And this is varying in the districts, in the regions of Germany, because, you know, it's complicated to describe, because all these measures are not decided by the national government. They are not decided by the Chancellor Angela Merkel, but by the different regions in Germany. We are a federal state.
I see. Meanwhile, Jan, on the vaccination front, German authorities recently approved AstraZeneca's vaccine for those aged 65 and above. What appears to have fueled this change in stance?
I mean, if you mentioned the study from the UK in your film ahead, and this, I think, was convincing the National Commission for Vaccinations in Germany. I mean, even with AstraZeneca, I mean, you reduce the risk of having to go to hospital, I mean, because of corona, and this is also applying to the elder people.
And what is the current public response to the vaccination campaign then?
I mean, now I think that the people want to have more and more vaccinations. I mean, they see that vaccinations are the only way out of this crisis. So, I mean, that's it. I mean, to date, just over 6% only of the population in Germany have received their first dose. This is not a success story, but this is more a question of failure from the authorities, and this is not due to a reluctance of the population getting these doses.
I see. Local news here, Jan, speaks about a vote of confidence for Korean face masks in 10 states in Germany, including Berlin. Could you tell us a bit about this, Jan?
Yes, I mean, there has been this approval of masks from Korea, and I think you can buy already Korean masks, by example, since a long time in Germany. I mean, 1 year ago, when the pandemic started, we had really a big lack of masks, and that suffered a lot of problems. Now, even there are now 1 or 2 fabrics in Germany who are producing these FFP2 masks made in Germany, and of course from all the other countries, by example, from Korea. Yeah.
I see. All right, Jan, as always, thank you very much for your time and your thoughts.
Thank you.
Right. Now, as part of efforts to address the plight faced by those who've lost their source of income amid the pandemic, a job fair was recently held here in the Greater Seoul area. We have details in this report.
The prolonged COVID-19 pandemic has taken a toll on small business owners and their employees. A number of small businesses closed down as they suffered a significant decline in sales. A survey has found that 70.8% of small businesses in South Korea witnessed on-year drops in sales in 2020. And by industry, the leisure service industry saw the sharpest decline at 43.9%. As you just saw, the job market in South Korea has deteriorated due to the pandemic, and it also has ravaged small businesses in the nation, making the owners and employees lose their job. And today, there's going to be a job fair held at this place to help them out.
코로나 때문에 좀 많이 모집하는 게 줄어가지고 여기서 채용 박람회 한다길래 한번 둘러보려고 한번 왔습니다.
This job fair is designed to provide job opportunities and related information to small business owners and their employees suffering from losses. Some 20 companies in the city of Yongin from various sectors such as shipping, manufacturing, and production management plan to recruit 370 employees. Those who wish to apply can have an on-site interview right away as long as they have resumes and cover letters. Yongin City is also offering free resume template as well as free copying and printing services.
성남 캠퍼스 네. 스마트 전기과인데 자격증은 기능사까지만 따왔어요.
지금 응시해서 공부하다가 중간에 이제 개인 사정 때문에 이제 취득을 못하였습니다.
네, 방금 면접 보고 나오셨는데 어떤 부분으로 지원을 하셨고 또 소감이 어떠신지 간략하게 말씀 부탁드립니다.
네, 시설 관리로 지원했었고 열심히 해야 되겠다는 생각 지원했습니다. 이제 좋은 결과 있기를 좀 기다리고 있고요.
So what made those companies take part in this job fair?
코로나19로 인해서 용인시에 이렇게 거주하고 계시는 분들, 그런 뭐 자영업자들, 소상공인들이 아주 어려움에 처해 있다고 알고 있어요. 그래서 저희 회사에서 마침 또 인원 채용을 해야 되고 해서.
With the rise of non-face-to-face services, some participating companies used kiosks to run virtual interviews. So because of the pandemic, some people rather prefer non-face-to-face interviews. So at here, you can use this kiosk to conduct your own interview.
코로나로 인해서 특별히 소상공인 분들의 피해가 많기 때문에 그분들을 위한 박람회를 긴급하게 준비하게 되었습니다. 저희 용인시에서는 코로나 또 지금 장기적인 경기 침체로 인해서 일자리를 필요로 하는 많은 구직자분들을 위해서 올해 상반기 5, 6월경과 10월에도 대규모 채용 박람회 행사를 준비하고 있습니다.
Both the central and local governments are making their utmost efforts to help their people recover from economic losses. We hope more of a practical and helpful policies to come out more in the future so that it can mitigate COVID-19 impact. This has been 신세벽.
모두 예방접종과 사망 간 인과성은 인정되지 않았고 기저질환 악화로 돌아가셨을 가능성이 큰 것으로 잠정 판단했습니다.
코박스 물량도 3월 달에 들어올 예정이고 2차 접종에 대한 물량도 현재 보유를 하고 있기 때문에 그런 점들을 고려해서 접종 계획을 가능한 한 빨리 수립을 해서 진행을 할 계획입니다.
Almost 447,000 people, roughly 60% of those within the first priority group, have received their first dose of the COVID-19 vaccine here in the country since the start of our vaccination about 12 days ago. Now, for more on these efforts and on related news, I have Dr. Alice Hyungyang-Tan from Ms. Medi Women's Hospital. Welcome back, Dr. Tan.
Thank you.
And I also have Professor Sarah Ok-shin from Korea University. Good to see you again, Professor Shin.
Thank you for having me.
Right, Professor Shin, at least 6 people who had received their first dose of the COVID-19 vaccine have tested positive. What are your thoughts on this?
Well, so there are several possibilities. It is possible that these people have been unknowingly infected without any symptoms because usually the virus incubation period is about 2 weeks, 14 days. And most people, especially young people, have no symptoms at all. So maybe these people were infected before the vaccination, or these people may have been infected after the vaccination, but maybe before the vaccine-induced immunity was kicked in. So usually it takes about 2 weeks for our immune system to make enough antibodies to fight against the virus infection. So maybe that was the case. But anyhow, we just started doing the massive vaccination program in our country. So it's been only less than 2 weeks. So I think we should not assume that this is a result of a failure of vaccine efficacy.
Right. And Dr. Tan, what is the vaccination protocol for such people? What happens when you become infected after your first inoculation? Can you get your second shot?
Well, here in Korea, the officials have said that the people who got infected after the first shot, or they were diagnosed after the first shot, that they will not be getting the second shot, which differs from the policy that's used in the United States. In the US, the CDC has said that people who get infected after the first shot, as long as they finish their isolation period and do not have symptoms, that they will be able to receive that second shot. Now, in terms of immunity after just one shot, we know that it's somewhere between 52 and 70% starting at 12 days after that first shot. The problem is we don't know the duration of immunity in people who've received just one shot of the Pfizer vaccine. We know that people, obviously, who've had natural infection, they will develop some degree of immunity. People who get vaccinated after having been infected, we know that that first dose of vaccine acts as a booster. So their immune status does go up. But we don't know about what happens in that immediate stage of, within 1 week of receiving the first vaccine. Say if a person gets infected, or the other way around, if a person's infected and they get that first shot, what eventually will happen. We don't really have a lot of data to know what will happen, but we do expect that the people who did get natural infection will develop natural immunity, and so they will have protection against the virus.
Right. Professor Shin, what are your thoughts on the efficacy of AstraZeneca's vaccine on the elderly?
Yeah, so according to UK's report, 80 years or older vaccinees who received a single shot of AstraZeneca vaccine had 80% decrease in hospitalization rate, and 70 years or older vaccinees had about 60 to 73% preventative effect against the virus infection. So I think these numbers are pretty good. It's not perfect, but it's not a bad result. It's quite similar to the numbers that we have gotten with a different age group, especially less than 65 years old. So with that, I think it's a pretty good result.
Dr. Dan, what impact would the approval of AstraZeneca's vaccine for the elderly and Pfizer's vaccine for those aged 16 and above have on our inoculation drive?
Well, so the original priority groups, the highest priority were those greater than 65 years old, people with comorbidities at high risk of developing severe disease or death due to COVID-19, and then healthcare workers. Unfortunately, the phase 3 trial results for AstraZeneca were not sufficient to prove efficacy in that oldest population, and so that's why vaccination was postponed in this group. I think if we allow people greater than 65 to receive the vaccine, then we're dealing with a little bit of a psychology versus science situation. What I mean by this is once we start vaccinating the eldest of our population, we know that the numbers of coincidental deaths will increase. And we're already dealing with a lot of vaccine hesitancy because of deaths occurring after vaccination, and we're having to continuously remind people that these are coincidental deaths. They're not deaths due to the vaccine, but they are deaths because of underlying medical conditions. It was simply those people's time to pass, unfortunately. Once we start vaccinating people over 65, the number of those kinds of deaths, coincidental deaths, will increase, and then there's a little bit of a psychological, like a spook factor that we're going to have to deal with to overcome even more hesitancy. So it's a balancing game that we'll need to play. We know that the vaccine is very safe. We suspect that it will help people over the age of 65 overall, but we do need to approach it cautiously. In terms of including the adolescents, age 16 and 17, I think this is very good news for those adolescents who have comorbidities, such as type 1 diabetes, cancer, heart disease, or lung disease, because I'm sure their parents and these children were waiting desperately for a vaccine to get protection. However, these children make up a very small minority of all youth, and so I don't think it will add a huge number of people to the pool of people getting vaccinated, but it will be good news.
Right, a very valid point, of course. Now, for more on the debate surrounding the use of AstraZeneca's vaccine on the elderly, we now turn to Canada. I have Professor Raywat Deonandan at the University of Ottawa live on the line now. It's a pleasure to see you again, Professor Deonandan.
Thank you.
Professor, Canadian authorities approved AstraZeneca's vaccine for all adults, despite the advice by members of the National Advisory Committee on Immunization. Please tell us a bit about this.
Well, initially, you're right. The government did approve the AstraZeneca vaccine for all adults over 18. However, a few days later, our National Advisory Committee on Immunization recommended that it only be used for those under 65. So that's the way it's being unrolled right now, with the exception of one province, the province of Quebec. And as noted, the issue is that the initial clinical trials didn't enroll enough elderly people to confidently compute an efficacy score. On the other hand, we have real-life data coming in from England and Scotland and other places showing that it does seem to work pretty well against the elderly. So the decision makers are weighing clinical trial data versus real-life data, and that's the issue before us.
I see. Now, Canada's vaccine rollout, Professor, began last December. How is the campaign progressing so far?
Well, we initially had ordered a great number of vaccines. Now, while we have those deals in place, we actually aren't high on the list of those in high priority to receive delivery. As a result, we're struggling with getting enough supply. So right now, about 4% of our population has received its first dose, which is quite small compared to most of Europe and the USA. I think we're ranked 38th in the world right now. But the government has promised us we'll get about 36 million doses by July, which is enough for most of, or the entire population, to get at least one dose. I think in reality, we're looking at between July and September before everybody who wants a dose getting a dose.
I see. And what has been the public response to the vaccination campaign, Professor?
It's been very, very positive. And the problem now is that demand outstrips supply. So our issue is we don't have enough vaccines yet, and we have a slow rollout with some hiccups, but we're getting there, and it's speeding up pretty fast.
I see. Professor, what is the official stance there with regard to vaccinating people who had once been already infected with COVID-19?
The stance is you should still get vaccinated, right? And as noted, natural infection is seen as a prime shot and initial vaccination is a booster. But right now the protocol is everyone gets the 2 shots if they're eligible.
I see. Professor Deonandan, Janssen's vaccine has also secured the green light in Canada, making it the 4th vaccine available after Pfizer, Moderna and AstraZeneca. Do you see this latest approval as perhaps adding momentum to Canada's inoculation drive?
This vaccine might be a game changer for a number of reasons. Number one, it can be stored for several months at basic refrigeration temperatures, so it can be given by pharmacists, by doctors, shipped to remote areas. But most importantly, it's a 1-dose vaccine. What we're seeing in the USA in particular is a lot of people don't show up for their 2nd dose. And that's wastage, and it also means a number of people won't get proper protection. This solves that problem. So this vaccine, I think, gets us to herd immunity faster with a lot fewer hiccups.
Thank you so much for your insights, Dr. Deonandan, as always, and for your time.
Thank you very much for having me.
Right. Professor Shin, what, in your opinion, is necessary to better promote public vaccination, generally speaking?
Well, first, I think it's important to give a sense of trust to the public and help the public to overcome any fear or anxiety over vaccination. So obviously, it's the best to get, the secure, high-quality vaccines, enough vaccines for everybody. But if that's not realistic option, then we will have to focus on, having effective vaccination programs and infrastructure so that we can make sure that, distribution and storage of vaccines to be maintained with the cold chain system. And also, I think we have to have a national liability system where we can compensate for any, side effects that might occur during the vaccination. So we can collect the information from people who've had or the adverse side effects, and we can. The government should be able to compensate for that. By doing that, I think public can feel more comfortable with the vaccination, and we can increase the vaccination rate.
Right. Dr. Dan, figures as of yesterday show Korea has managed to offer the first dose of the COVID-19 vaccine to more than half of the people in the first priority group. How does Korea's vaccination drive compare to that of its counterparts elsewhere?
Well, I should start off by saying that we should focus on the end result and the path and the process toward that end result, and not get too discouraged if our beginning numbers don't look that encouraging. In terms of the number of daily doses per 100 people, so that's a figure used to determine the rate of vaccination, Chile leads the world with 1.08 doses per 100 people. Next is Israel with 1.03. The US is 0.65. The UK is a little lower at 0.51. Korea is right in between Russia and India right now. Our rate is 0.09. Russia is 0.14 and India is 0.08. So certainly we're not, leading the pack when we talk globally. But as I said, we should stay focused on the process, and I think we have had a fairly successful beginning. In terms of percent population fully vaccinated, the tiny territory of Gibraltar actually leads the world. Their population is 46.2% protected, fully vaccinated now, followed by Israel at 42%. The UAE is 22%. The US is almost 10%, so 9.4%, and the UK is 1.7%. Korea, of course, in terms of full protection, we're at 0%, but in the next 1.5 to 2 weeks, people will be receiving the second dose of Pfizer, and then 2 weeks after that is when we can say we have people who are fully protected through vaccination. And so really, I think we should stay focused on the process and making sure that it stays smooth and well controlled and successful. And we're on track.
Right. Now, Professor Shin, this is something that Dr. Dan touched upon earlier, but authorities here have tentatively ruled out a possible link between COVID-19 vaccines and the recent fatalities of people with underlying health conditions. How do you respond to this?
Well, first of all, if the vaccines were to be the direct cause of the death resulting from vaccination, then they have to look at the time points of when these people started showing the symptoms related to death. And it was found that these people did not really suffer from what's called anaphylaxis reaction, which is a severe allergic reaction that happens within 30 minutes or so after the vaccination that can lead to sudden death. And so, and also additionally, the KCDC has checked for the occurrence of these side effects, adverse reactions in people from same institution and same vaccination date, and also the same serial number vaccination. But there was no reported cases of severe reactions from these people. So given that these 8 people were reported to have, long history of underlying medical conditions like cardiovascular disease and diabetes and epilepsy, maybe their death was due to the exacerbation of these underlying medical conditions rather than the vaccination.
Professor Shin, do you see these tragic losses of lives perhaps as affecting public confidence in the country's vaccination campaign?
Yeah, I think the media maybe has responsibility for that because we get this news alert about the fact the vaccinated people have died right after vaccination, but they don't really provide information about whether the vaccination was a direct cause or not. And it takes time to determine if the vaccination is the direct cause. So we should be very careful about, trusting the media.
We should. Dr. Tan, keeping in mind what Professor Shin has just said, how would you tell, or what symptoms would let you know that you could be prone to adverse effects from vaccines?
Well, anyone certainly who has had a history of anaphylaxis due to any substance, be it a vaccine or a food or a medicine, they have been shown to be at higher risk of developing anaphylaxis, especially after the mRNA vaccine. So I say that's the first risk factor. Other considerations are people who are frail, very old. Perhaps they will not be able to tolerate the side effects after vaccination, such as high fever or muscle achiness. And so those are the two groups, I think, that are at higher risk of developing adverse effects after vaccination. But for the vast majority of people who do develop side effects, and actually side effects are quite common. 1 in 10 people can have a little bit of a side effect. They will be mild and they will resolve after 2 to 3 days. I think people who are in these higher risk categories, they should definitely be monitored. Don't stay home alone in the next 2-3 days after vaccination. And then make sure, as I said, that you're very well hydrated when you're going in for your vaccination, and that you make time so that you will stay at the center for at least 15 minutes, maybe 30 minutes after your vaccine, so that if there is an immediate reaction, that you could get medical attention right away.
Right. Meanwhile, Dr. Dan, over in the US, authorities there have announced that fully vaccinated people can gather in the absence of face masks. What are your personal thoughts on this?
Right, so on March 8th, the US CDC made this announcement. They are interim guidelines for people who are fully vaccinated in terms of what they can do, what they should do. So in a non-healthcare setting, fully vaccinated people can meet other fully vaccinated people indoors without a mask and without distancing. Also, a fully vaccinated person can visit an unvaccinated person as long as it's within a single household and that person is at low risk for developing severe disease or death due to COVID-19. And then lastly, the guideline says that people who have been fully vaccinated can refrain from quarantine or testing after exposure to COVID-19 if they are asymptomatic. Now, Korea, we're going to have to come up with our own guidelines, of course, in the near future, because we will have more and more people vaccinated. But in terms of the framework for what we need to consider the person, the place, the prevalence of the disease, also the protection level that we are going to recommend, and the activities that are allowed. By person, I mean, have both people been fully vaccinated, so the vaccination status of the person going to visit and the person receiving the visit. Also, the risk in terms of, is the person at high risk of death or disease due to COVID-19? And then the occupation, I think, is also something to consider. If a person is in a high-touch occupation, when they're going to be encountering a lot of people, perhaps they may want to use different levels of protection. In terms of place, we need to consider, will the encounter take place indoors or outdoors? Is there sufficient ventilation? The density of the number of people in that place that the encounter will take place. Is it a private or public venue? And then the prevalence in the overall community where we have these guidelines, I think, is something that we should take into account. And then the level of protection. So they said no masks and no distancing required. My concerns are that the vaccines that are approved, we still do not know fully if they protect against transmission of the virus in people who get infected despite vaccination. Also, we're still investigating the vaccine's effectiveness against variants. So, with these two unknowns, I think in terms of the level of protection that's recommended, In my opinion, recommending a mask and at the minimum, hand hygiene is a good idea. In terms of the distance, we can consider what level of distance we will allow. And then, of course, the activity. So there are high-risk activities such as singing out loud, embracing, sharing a meal. And then there are low-risk activities such as what we're doing, speaking at a distance into a microphone. So these are all things that we can think about when we come up with our own guidelines. The US, it seems a little bit bold, in my opinion.
Right. Staying with that, Professor Shin, do you believe this new recommendation on face masks in the US can be applied here in Korea, given our current status?
So I totally agree with Dr. Dan's opinion. We need to come up with our own guideline when the time comes. And also, there are so many unknown variables that can affect this guideline. But first of all, we must consider that our vaccination situation is quite different from U.S. situation. Right now, as of today, I believe almost 18% of U.S. citizens have gotten at least one shot of vaccine, where in our country we only have less than 1% who got the first shot. So, the situation is very different right now to consider this kind of guidelines right now. So I think that right now is not the right time to think about the issue. Also, I personally think that, we have to consider about the variant viruses, this emergence of variant viruses, because there is a recent report suggesting that, the current vaccines are not going to give us the full protection against the variant viruses from South Africa or Brazil. And we know that variant viruses are emerging and it's spreading quickly than we thought. And it's, I think it has higher ability to replicate at efficient level, and it can actually transmit to other people with a lot higher level. So I think we have to think about, even third vaccination with the variant virus vaccines. So maybe, I think it's probably better for us to, have social distancing and wear masks just to be safe, I think, for now.
Professor Shin, as a medical expert yourself, this is something we touched about yesterday as well, but what are your thoughts on suggestions that the vaccination of the public should start with those in their 30s and 40s as they are much more active in society? What are your thoughts on that as a doctor yourself?
So you mean starting the vaccination for
those who are younger? Because a lot of the countries, including our own, focus much attention on those who are older. Mm-hmm. But there are suggestions that we should be vaccinating our younger adults quicker.
Oh, you mean as early as possible, you mean? Well, I mean, to reach the, ideal herd immunity, we'll have to have, at least 70% of our whole population to be vaccinated. And, obviously, younger group of our, 30 or 40s age group, we have to consider these people to be socially mostly active groups. So, they are the high-risk group, I think, for transmission, at least. So, yeah, I agree that, these people have to be vaccinated as early as possible. But, we have a high priority group is actually the elderly group. So after vaccinating all the elderly group, we can think about, moving towards to younger group.
Right. Mm-hmm. And finally, Dr. Dan, what more can be done to further boost public confidence in the vaccination campaign?
I think we need to continue what we're doing now in terms of IT, information and transparency. More information, more transparency every day, just as we've been doing. I think it's very important. Also, facilitation of vaccinations. In other words, the process of getting a vaccine, signing up for it, going to the site and getting it. We need to make sure that this is easy to do, not a frustrating process. Also, we need to make sure we have good public engagement. So this is like a marketing campaign for any product that we're trying to sell. We need to make sure that we're communicating the facts, but also telling stories, success stories, move people, emotion-wise to want and go and get the vaccine. And then also make sure that we are letting people know of what are the benefits of vaccination. On the 8th, the KDCA news press briefing, Professor Kim Jung-gon, he laid it out very clearly, and it was a very powerful message. He said there's only 3 ways out of this pandemic. One is if the virus mutates to a insignificant, very weak form, and then it becomes just like a cold, we don't need to worry about it. That's not gonna happen. The second is if we develop natural herd immunity where everyone gets infected and they have immunity, but we saw what happened in Sweden where there was an unacceptable level of deaths, preventable deaths, and so that's not gonna happen. The third is if everyone gets vaccinated and we develop herd immunity. That is the one and only viable way to get out of this pandemic. And so the faster and the safer that we all go and get vaccinated, the earlier we're going to have an end to COVID-19. And I would like to just have this message repeated over and over again, maybe in different forms to appeal to different populations, but that's really what we need to do.
Right. All right, Dr. Dan, as always, thank you very much for your insights. And Professor Shin, thank you for being with us today.
Thank you.
Right, adequate vaccine supplies and prompt public vaccination are some viable ways of fighting the pandemic, according to our Dr. Dan, as well as other health experts. So until both are possible, do seek to take care. Thank you for watching.